Good afternoon, everybody, and welcome to the weekly brief here at the Health Department. My name is Justin Westmiller. I'm the Director for Homeland Security and Emergency Management here in St. Clair County. And we have a special guest today. I'd like to introduce him, sir.
I'm Dr. Sridhar Reddy. I'm Chief Medical Officer of Lake Huron Medical Center, and I'm a pulmonologist. Typically, that means I'm a lung doctor. Thank you.
And we are so glad you're here, Doctor. Obviously, Dr. Mercantant is out this week, and Dr. Reddy is filling in, and we are very happy to have you here with us.
I'm glad to be here.
Thank you.
More than you can think.
Yeah. So, first off, we're going to start with our normal weekly update, and we're gonna change it up a little bit. This week we started with the free testing at the Health Department, the COVID-19 testing, the PCR testing, and if any of you watched, I went live and did it myself this week earlier on Tuesday. And it went very well. I think we'd agree with that. And, or I'm sorry, I did it Monday, right? And then we went and did it here Tuesday free. And so we did 57 tests. The health department did 57 tests, and it was very successful for our first day launch. It was like 93 degrees, and the health department, the public health nurses did a really wonderful job. So proud of them. And they continue to deliver, and they do a great job. So we will continue to do that every Tuesday, every week on Tuesdays. You do have to make an appointment, and so I think they have to dial the telephone number. What is that? It's 987-5300, and then follow the prompts for testing. So you do have to register for that. You have to be 18 or older, so you have to get an appointment. You must be 18 or older to do that, all right? And that is drive-through. There are drive-through and walk-up lanes to make that happen. So please come out. If you need a test, those tests are available, and we're ready to make that happen for you. All right, so let's talk a little bit about where we are in the county with COVID-19. So as of today at 8:30 in the morning, we have 0 new cases. I think in the last 6 days, we've had only 1 new case in the county. That is the best we've done since March 10th. So really, really good. We only have 23 active cases. That means 1% of all hospital beds in our county are being utilized for COVID-19. That is very, very good news for us here in the county, and we want to keep that going. So please, everybody, do all the things that you've been asked to do, that social distancing, keep that 6 feet between you as much as possible. Continue to use those masks to help protect the people around you, and do all the other things that you've been asked to do to make sure that we can keep the spacing and keep all of the COVID away from each other as much as possible. All right, some more good news. As you know, every week we talk a little bit about where all of the cumulative cases are in the county, and this is just our updated map. No big surprises there since we've only had 1 case in the last 6 days. This is some really, really good news. So we've kept this graph very flat in the last 3 weeks. 0.29 total cases in the county for the last 3 weeks. And without long-term care and jail cases, we are at 0.00, which means per 1,000 cases, we are at a 0. That is very good for St. Clair County. Another very good trend, you see the percent of COVID-19 tests that were positive continuing to trend downward to below 10%, closer to 5%, while the testing stays pretty moderate at about 7.5%, I think is where it's sitting, right, Brandon? Pretty close. So we're beginning to equalize, which is another good number, all right? Doc, anything on that? What are your thoughts?
So one of the things is that the harder we look, obviously the more cases we're going to find, and so that's why it's relevant to find out how many of those tests are actually positive. And so that's where we kind of came up with this 12% number that people are looking at. So if you do 100 tests, if 12 or less are positive, then it's a good trend. And we're clearly probably half of that, and that's a good trend. And if you look at that curve over there, it's a lot smoother, it's coming down, so it looks like it's very credible information.
Thank you. All right, so I think that's it for the updates for St. Clair County. Again, we're trending very well. Over the last 3 weeks, we're seeing really good numbers. This is all positive information as we start to re-engage our economy. We're really working hard to do that. A lot of the leadership in the county is working hard to do that. We have stood up a task force for re-engagement and moving the economy forward, moving the operations forward in the county. There's meetings with education groups, with community recovery groups. There's a lot of work going on in the county with all of your county leadership to get things going, and there'll be a lot more to follow with that. But I want to give a lot of confidence to all of you out there, everybody viewing this, that the right people are doing the right things in every part of the county to get things back on track. So with that, Jen, do we have any questions?
Yes, we do. Okay, one question was, how many tests have we done since June 5th? And that answer was 494.
So the question is, how many tests have we done since June 5th? And the answer is 494. So we know that just a couple weeks ago, we were really struggling to get a lot of tests done. And in just, 6 days, we've been able to turn out almost 500 tests. That's a far cry from where we were just even a month and a half ago.
And Justin, you might want to mention that overall, in St. Clair County, there's been 7,659 tests done.
And overall, we've done 7,600 and almost 7,700 tests, just shy of that by 5 or 6. So we're really doing a much better job. And some of the reason for that is we have much better access to testing supplies, and that's a big part of why we're able to turn out so many more tests.
So I believe right now there are multiple sites where you can get tests. The testing capability is up to speed. So essentially, there is no shortage, as far as I know, of supplies and getting the tests done in a timely fashion, which is different from what it was, what seems like many, many months ago, but maybe just a couple of months ago.
Absolutely. You know, I'll tell you that March and April seems like a lifetime ago almost, right?
Yes.
Because of what a drain on all the supply systems and all the medical systems and everything else. You know, obviously it doesn't hurt that it's sunny out now and that it's more comfortable outside now. But we all know that March, April, and the first part of May was a very difficult time for our community. And we are able to make things happen a little more now. So.
Okay, so speaking of tests, the next question is, who would need a test? Doctor?
So it depends on, when you say who would need a test, it really depends on the circumstances you're in. So if you're essentially trying to find cases, which we are, then we want to broadly test people. Some people have been exposed to someone, or they were in a high-risk situation. They might be someone who you'd want to test, but definitely anyone who has symptoms that are unexplained. So the World Health Organization kind of says that if you're in an area where there has been widespread transmission of COVID-19 and you have no other explanation for your symptoms, then you might want to get tested to make sure it isn't or is COVID. Thank you.
Okay, next question. Now, I'm not sure where this person's coming from, so you'll want to repeat the question.
Mm-hmm.
It's three-pronged, okay?
Mm-hmm.
What is the description of a sore throat? Is it a dry, scratchy sore throat, or is it a localized throbbing sore throat?
So the question was, what is the description of a sore throat? Is it a dry, scratchy sore throat or a localized sore throat? So anyone who has a soreness in their throat or symptoms in their throat, that could be a sensation of irritability, that could be frank pain itself. It does not have to be localized when it comes to a virus of any kind, and that includes the coronavirus or COVID-19. So I think if you have a symptom that's trivial but unexplainable and it comes from your throat, typically you would consider that a sore throat, and you would want to at least be aware that you might need to seek medical attention depending on what situation you're in.
Okay. Next question that was written here. What are the problems with opening the libraries?
So we actually have some good news on the libraries. I was told, I believe yesterday via email, that the libraries are going to start re-engaging slowly here in St. Clair County. So the issue with the libraries are very manual. Everything they do is very manual. There's a lot of touching going on in the libraries. So they were probably one of the most cautious departments in the St. Clair County government system, and they just wanted to take the time to understand how they could re-engage slowly and safely to protect themselves and protect their customers, which is all of you. So they were just taking their time and ensuring they had the right safety precautions and the right cleanliness precautions and everything else they needed to do to re-engage properly. And we believe they've done that, and they believe they've done that, and they're starting to re-engage slowly as of next Monday.
Okay, next question was, can you explain the ranges of the deaths from COVID in St. Clair County?
Absolutely. So the question was, can we explain the ranges of the deaths here in St. Clair County?
Age range.
Age ranges, I'm sorry. And what I will first say is we have 517 confirmed cases here in St. Clair County with 120 hospitalized throughout the event, starting from the middle of February all the way through today. We have 45 fatalities with COVID-19. That's a terrible number, right? We have 45 people in the community that have passed away, and that is sad. But what I will tell you is St. Clair County did some really good things to ensure that we kept that number as low as possible. And in our region, we were the lowest, both case number wise and fatality wise. And some of those numbers, so in the 30 to 49 age range, we were at 4%. At 50 to 59 age range, we were at 16%. And at 60 to 69, we were at 11%. 70 to 79, we were at 36%. And 80 plus, we were at 33%. Okay, so we kind of followed what has been said of this disease all along, and it very much affected the older age range quite a bit. We followed that trend. Would you agree?
Yeah, so I think we, from a common sense perspective, have always known that viral infections are worse off in the elderly and those who are vulnerable from other medical conditions that may be pre-existing. And that shows that we were able to protect, I think, the right people. And unfortunately, we've had fatalities. Any fatality that is, I think, preventable is actually very sad. Yes. And so we take each of these at heart. But we haven't seen like an excess in a certain group compared to other communities. Thanks.
Yeah, you know, and we've said this a lot, but COVID-19 is a very difficult. It's a difficult disease to work through, and this was hard, and it continues to be hard, and we feel for each and every family and friend of those that passed away, and we continue to promise all of you to work as hard as we can to make sure we get this as right as we can. So, thank you.
So what was very interesting when it came to the elderly specifically, and these are anecdotes from my practice and just talking to people, is the fact that by staying apart, for whatever reason, we've all come together. And we've had a lot of senior citizens saying that people who they would occasionally see or meet would call them, try to get supplies for them, try to get food for them, and do it in a respectful way by respecting their physical space just because of the ability for transmission from an asymptomatic individual. So they'd leave food on the door, they would call them and tell them when they're coming and stuff like that. And it was, I think, stuff that I haven't seen, in the past.
Yeah, the community came up with a lot of very wonderful ways to help the elderly and to help the people that were compromised in other ways, and our community especially. And so I thank you all.
Okay, next question. If both people are wearing masks, can they hug each other?
So you can hug somebody if you want to, and that's a good thing. Hugs really help. The transmission, we believe, is typically by aerosol. So if two people are wearing masks, so let me go back a little bit on the mask. What we know for sure about masks is if you wear a mask, you're protecting the other person. You may not be protecting yourself as well, but you're definitely protecting the other person. So using that logic, if both of you are wearing masks, then I believe that it's safe to hug. But again, more than whether you're masked or not masked, it's actually the amount of time you spend in the same breathing space that makes a difference. So let's say you're masked and you're sitting in a room for 2 or 3 hours together for 4 or 5 days in a row. That's worse off than a quick hug, that meant that you cared about the other person. Obviously, hand washing, don't touch your face after any contact with someone who's suspected to have COVID or even asymptomatic. That's all common sense stuff.
Okay. Next question. This person has been doing their parents' grocery shopping for them, their elderly parents.
That's nice.
And is it safe for them to do their own shopping now and wear a mask and sanitize their hands as far as going out and doing their own shopping?
So the question is about the elderly. Their children have been doing shopping for them for groceries and everything. And the question is it safe for the elderly to go out and shop for themselves? Based on the data we see here, based on the trend where we have a low positivity rate on the tests, means that it's safer than it was a few months ago, but it's not absolutely safe. So I'd still use common sense precautions. If you're elderly and you're unable to have someone get your groceries, do the right precautions. So mask, wear your gloves, don't touch your face after you've been shopping, and then try to look for hours that are protected for people who are vulnerable. So these might be an hour early in the morning that some stores have just for either seniors or someone who has a medical condition, and practice social distancing. Ultimately, there may be no complete right answer to this because you're basically on a spectrum of risk. And so you essentially also have to do what you are comfortable with for you and your family.
Okay. Why don't we take a question from each of your sheets now?
So the question here is, what is the difference between the PCR nasal swab test and the antibody test, the blood test? Both are not so uncomfortable, but somewhat uncomfortable in different ways. So the nasal swab, obviously you have to have a swab go down the back of your nose and your throat. But the blood test has to be that you have to be poked. So I think they're basically the same from that perspective. The PCR nasal swab essentially gets to tell whether you have viral particles or a part of a virus. So this could be that the virus is alive and you're finding the particle. This could also be that you maybe had symptoms a few weeks ago, the virus is actually dead, and you're finding particles of the virus. So you want to put the PCR test in perspective. So you're finding the viral RNA, which is similar to what we all understand from all the crime shows of DNA. So you're finding the viral RNA. And similar to how you can find someone's DNA 20 years after a crime, you might find the RNA PCR being positive when you're symptomatic and you actually don't have active disease, but only for a short while, typically days or weeks. The blood test or the antibody test is a test essentially to say whether your body has seen this virus and mounted a response to it. So there's different antibodies. One is the IgM antibody, which is an immunoglobulin made by us that comes a little earlier than what's called the IgG antibody. And there are several labs that do both the antibody tests so that you get a complete panel, if you will, and that tells you whether you've been exposed and whether you've mounted a response to that virus or your memory of it. So let's assume that you have an antibody test 4 years from now. It might be positive because it's telling you that 4 years ago you were exposed to something. For example, the chickenpox virus, there'd be a chickenpox test or a coronavirus, and we're not sure what the antibodies do in the future. So if someone has active symptoms, typically we try to do the nasal swab PCR to see if they have viral particles and if they're shedding those at that time. And then we typically try to do the antibody test once we have a history that they've been exposed to someone who's had the virus. They work in an occupation such as a frontline worker that could have been exposed or has a high risk of exposure, to essentially see if they have or they have not been exposed. It's not clear at this time whether the antibodies protect, though we hope they protect. So let me give you two weird examples. So if someone has the HIV antibody, it means they have HIV disease, but it doesn't mean the virus protects, the antibody protects them from the virus, because they still need all their medication to suppress the virus. But the chickenpox virus and the measles virus, typically if you have antibodies to those, it means that you're almost completely protected from getting the disease a second time. And we're not completely sure where the coronavirus stands. And the reason I bring this up is that if you have an antibody that's positive in you, it doesn't mean you could be macho and stop doing social distancing and stop wearing a mask. You still have to do the common sense stuff that's recommended to decrease your exposure to the virus, because we really don't know the history of how and what this antibody means. It's a little long drafted answer, but I hope I got the point across.
Yeah, that was great. All right, so my first question is, what changes have you made to safety protocols at the EOC because of COVID-19? And we've actually done quite a bit at the EOC because I'll tell you, EOCs aren't normally known for a lot of safety protocols to keep disease out. They're normally a place where a lot of first responders and a lot of agencies come in, and everybody works in a very tight place to make sure we can manage an emergency. So what we've done is we have, the county administration has given us a guide that we work off of, and we've also done a lot of research to put in like towel dispensers that are automatic. We had the whole place cleaned by a professional company, and they put a microbial glaze over everything that stays for 90 days. That really helped us out a lot, made it clean a lot easier. We've put in a whole registration table that everybody has to sign into every day, kind of like they do here at the health department, where you take your temperature and sign in and talk about if you have any, if you have a temperature, a fever, or a sore throat, or any sort of breathing issues that day, so any symptoms. We also have been able to kind of spread people out all over the building instead of just having them in the EOC itself, which has been very helpful. So we have quite a bit of social distancing. So we've taken some fairly interesting steps that usually wouldn't be done in the EOC. Usually you want all the decision makers in one room, but now we've really spread everybody out into 4 different rooms, but we've figured out a way to keep that so it's operationally capable. So we've done quite a bit in the EOC to make it safe for COVID-19 operations.
Okay, we have another
question. So in the hospital, similar to the EOC, we have a universal masking policy for all our employees, unless we think we can maintain a 6 feet distance, for example, in some random meeting where we are sitting far apart, because not all of us like each other when it comes to administrators talking. I'm just joking as far as that goes. And then we do screen people at the entrance. Any patient who's admitted to our hospital for either an elective procedure, comes in for an elective procedure, or is admitted to the hospital is actually tested by the PCR nasal swab that I talked about, to ensure that they are not risk for themselves, their family, or for their extended family, which is all these workers in the hospital, all these nurses, nurse aides, everyone in dietary and supply chain, and everybody who works over there. At Lake Huron Medical Center and at the other hospitals in the county, it's safe to, again, be that trusted partner where you can come, get your health care, come back for your elective surgeries. We at Lake Huron Medical Center, again, take this very seriously, as do the other hospitals. And we offer both forms of testing in the appropriate group, either the PCR or the antibody. So it's been sad to actually see within our community, but in other communities as well, where serious illnesses that are unrelated to COVID, there have been delay in diagnosis and people seeking treatment, primarily from the fear. So my mom and dad live down in Florida in this small community, and they walk around outside, and I say, whatever you do, just do your walks outside and see what's happening in town, but don't watch the news too much.
Yeah.
And I think that's where a lot of the fear had come from.
Yeah, so at the end of the day, please, if you need any sort of treatment and you think you might need to go to the emergency department, but you're not quite sure if it's safe, go to the emergency department. Get seen by a doctor. We both assure you that it is quite safe. And if you need treatment, go get it, please. So.
Okay, I know we're almost out of time, but we had 2 more questions.
Let's do it.
Come up.
Yeah.
Okay.
We'll extend a little today.
Okay. One is, how is COVID affecting those with diabetes, and what extra precautions can those people take who have diabetes to protect themselves?
I am definitely giving that one to the
So
doctor.
I am not sure where COVID virus stands with diabetes and the data that's out there. What I know, I think from personal experience, talking to people and whatever little data is out there, is that it seems to me, or it's plausible, that the virus is not cleared as easily in someone who has diabetes, because the immune system is not as robust as other people's immune system. So what I'm saying is that if you're diabetic, you might be at the same risk of being exposed to the virus, depending on your social distancing measures and all that. But I think if you get the virus, I believe it's harder to clear. And based on that, I think it lingers on a little longer, and because of that, the outcome actually might not be so good, either with temporary worsening of your condition, permanent sequelae, and sometimes even death in diabetics. The one disease that I'm really worried about with COVID-19 are actually the diabetics, where I think that the virus, for whatever reason, hangs out long and they have a poorer outcome.
Is there anything that people with diabetes can do, like take supplements and such, to help protect themselves?
So I think the best thing a diabetic can do is to make sure their sugars are tightly controlled, because it's been shown in other conditions that if your sugars are not tightly controlled, then you're at risk for bacterial and viral infections and having a worse outcome. From a supplement perspective, I don't think that there are any scientific studies, and I'm not aware of the logic behind using a supplement in a diabetic to prevent the coronavirus. But I certainly believe that, again, tightening your blood sugar control has added benefits in addition to the coronavirus outcomes being better, I think.
Okay. Last question that we have so far is, what are the chances that COVID doesn't hit again and twice as bad with all these establishments opening, especially with the news reporting that COVID has resurged in 21 states now and such?
So I'm going to take that one for a minute. So
Sure.
Here's what I'll say.
You want to repeat?
Yeah, so the question is, one, what's the opportunity for resurgence or a second wave of COVID-19 in our community? Because we've seen on the news that like up to 21 states have had a major resurgence. And if that happens, how can we change that outcome? Well, there's not really a way necessarily to change that outcome other than doing things like continuing social distance, doing all of the hard work that we've already done, like wearing our masks, and following some of the rules that we can follow while still re-engaging our community. You can re-engage your community safely or more safely, right? We're not obviously in a lockdown type situation anymore, but you can still follow the social distancing and things like that. Understand that we don't have a lot of control necessarily on a resurgence. Would you say that's right?
So I think the virus definitely does not discriminate.
Right.
It's been in all age groups, all races, all pre-existing conditions.
It's a
So
virus.
it doesn't discriminate. Having said that, when Justin was talking about safely re-engaging a community, it really depends on whether we think that we as a community are prepared or we're not prepared if there is a resurgence or if this thing dwindles along. Personally, I don't think there'll be a huge, like a tidal wave, either this year or next year. I think it'll kind of peter off a little bit. It won't be, I don't think it's gone away. I don't think it magically just disappear. And I think there'll be some spots where there might be a little bit of heat over there. But in general, I think we in the medical profession, and speaking for the hospitals in general, and specifically for my hospital, we all feel that we're much better prepared in finding these cases very quickly and then doing something about it. The first few weeks, we couldn't find cases, and when we found them, we weren't prepared on what to do. There wasn't much scientific data out there. And so I think this time around, if it were to happen, and God forbid it doesn't, that I think we're better prepared and we feel a lot more comfortable in taking care of these patients. When we talk about flattening the curve, sometimes we don't talk about the area under the curve. So let me explain that a little bit. So if there are 100 people who are going to get the virus in a community, we don't want all those 100 people to get it in a week. We want them to get it over a 6-week or a 2-week or a 2-month or a 1-year period. And I think we've successfully flattened that curve, and again, we're better able to deal with anything in the future if it hits us in the same proportion. And hopefully it won't hit us with the same proportion, but much, much less.
And I know, having spent as much time working with the staff here at the health department, they are so very good at tracing and isolating people in the right ways now that and they have learned so much about this disease, the same way that Dr. Reddy's talking about understanding how the disease works a little more now, and having that data that I don't think you'll see the major outbreaks, at least in our community. They're much more able to react and manage and isolate and trace. So I think we're in a much better footing now than we were in February, March, and April. I don't think it'll catch us by surprise anymore. And now we have a much better access to testing supplies. We just have more in our arsenal than we had back then. We're in a much better place.
Okay, closing thought.
Can I answer these two very important questions, please?
Okay.
We just need to. So, two things. We are going to change our daily updates to a weekly update starting next week. So instead of seeing a daily update Monday through Friday, starting next week, coming out of the EOC and out of the health department, you're now going to see a once per week update on Fridays. But please don't despair. You will, every day we are going to put an update onto the dashboard. So you will continue to see the information on the dashboard. We just won't put out to Facebook and everything else a daily update. That will only come out weekly. There's some reasoning behind that. One, as you see, we flattened out our numbers enough that there's really no new information. So no new information really doesn't need an announcement that we have no new information. If we get to a point where we start seeing a need for information daily again, we'll re-ramp up and I'll start putting stuff out again, and Brandon will start putting stuff out again. So, but that's what we're going to do for now, and there'll be more to follow on that. But you will see an update next Friday, and we'll go from there on that. Also, if you have any questions or you need any information out of our group, out of the EOC and out of the health department, or you have any questions, please email the information or call the information hotline at 810-966-4163. We will answer all of your questions, and if you don't get a live person, please leave a message and they will call you back. You can also email us at covid19@stclaircounty.org. Okay? Those are the two ways to make sure that you get any of your questions answered at any time. All right? I just wanted to make sure we got to those two things. Other than that, Doc, if you want to wrap it up, and then I'll follow you.
So there are a lot of things that have changed pre-COVID to post-COVID. And one of the things I think that's changed is the expression, see you later, goodbye. And that's changed to, I think, be safe.
Yes.
And I think that's my message is for all of us to be safe. the definition of how to be safe has changed over the last 2 months. There was no masking, then there's masking, then there's does it work, does it not work. There's all kinds of controversial information. You can get any answer you want on the internet that you're looking for. But what you have to do, I think, is to figure out what being safe means for you, your family, and your community, and to just be involved in the changing guidelines that may come and go and change based on the situation we're in. And that's all I have to say. Be safe.
What I'll ask is, and I continue to ask this, is be as flexible as possible while understanding that we're continuing to write this book as we live it, right? And I appreciate you, Dr. Reddy, for being here today. It's been fantastic learning a little from you. And we are going to continue to work through this. We're going to continue to learn from our friends in the hospital systems. We're going to continue to learn from our friends in the education system and in the business world and in the government world. And we're all going to have to work together to make sure that we do the best for our community as possible. So I thank you all for being with us today, and we'll see you again next week. Have a great weekend.
Thank you.
Thanks.